Hey, I'm Brennan. I am here again answering some questions related to being trans, and I run a blog called Gender Den. I'm also on like my 8,000th cup of coffee today, so please excuse any zaniness. Alright, my first question, sorry, um, comes from Caitlin, who wants to know what are some of the difficulties a trans person faces when they are romantically interested in someone who isn't aware that they're trans. She knows that I've been seeing my boyfriend since before I started transitioning, so she's not sure if that's been the situation for you. Yeah, she's just kind of wondering about disclosure and when do you disclose, how do you figure that out. Like she mentioned, I was already dating my current partner before I came out and started socially transitioning. I was questioning while I was with him, but that was very private. He didn't know that, so that was a huge thing for our relationship, and that's been really interesting to deal with as a couple. But yeah, you know, I do worry. I mean, not worry like actively because I am like really committed to my relationship, but you know, just like thinking about dating, you know, that is something I've never really had to experience, like having to, you know, be like, hey, like I was born female, like, you know, I have a female body, like, I don't have a typical body that you would expect if you were, you know, expecting to sleep with somebody who looks like me, you know. Once you know, like, I given testosterone, and if that's, you know, the path I choose to take is sticking with testosterone, then that will be a concern if, you know, things with my current partner don't work out, you know, that will be something I might have to deal with in the future, but, yeah, I don't really know much about it now. But yeah, I mean, dating someone who isn't trans definitely has its challenges, you know. It's hard sometimes because I feel like we don't relate on a lot of things. I feel like there's some things I wish we could talk about that he just doesn't understand. But that's stuff that I deal with everybody, because you know most people I know aren't trans. So there's a lot of not being able to relate to people going on. So it's not just oh my god, my hair is crazy. It's not just like in my relationship that happens. Okay, the next question, I need to kind of hunt it down because it's on my Facebook. I know it's something about being in, it was from Raleigh, and it was related to being in, dealing with being misgendered as a service professional. I'm a waiter, and I do get misgendered all the time. I don't pass, unless someone's like, you know, sometimes when I'm walking down the street and it's always the guys who like hand out the mixtapes, like the black guys on the street who are like, oh, the mixtapes. They're always like, hey boss, like, I wonder if there's a thing with like, you know, I find it harder to discern gender with people who aren't white, so I wonder if like cross-racial recognition is a thing, because largely, you know, white people generally misgender me more, which I think is interesting. Anyways, that aside, yeah, you know, like, I definitely deal with being called miss and ma'am, and, like, you know, little kids at my tables would be like, Mommy, is that lady a girl or a boy? And they're like, oh, she's a lady, and it's like, I always kind of want to be like, you know, that's kind of something you shouldn't, like, answer for somebody, but I also, you know, I'm waiting on this table, I'm trying to get their tip, trying to get their money, I'm trying to sell them stuff, I'm trying to let them have a good dining experience where they aren't going to be told how to parent by some, like, queer waiter who's bringing them water and margaritas. So, yeah, like, that's not really something that I deal with yet. I think it's going to be a little bit more interesting once I start tea, and will be more, will be kind of like harder to read, I guess. I do think I get read as female more these days. Anyway, hope that answered that question. That was kind of not adequate in my opinion. Okay, but the next couple questions I got are from Jeannie, who has been a really good friend of mine since kindergarten. We go really far back, and she's actually studying to be a doula, and So she's taking, women's health classes right now, and they're talking about trans health because it's not very well understood in like reproductive health and family planning fields. So her first question is, she acknowledges that the English language isn't so great as far as pronouns and transgender people. So her question is, have there been any creative words created that express one's preference? So yeah, just the first part of that question, there are a lot of like self-creative and personally defined pronouns are out there. Some of the ones I can think of off the top of my head are like Z, like Z-I-E, and here like H-I-R, Zim, Co. Like there's some people, like there has been like a reclaiming within the trans community, like this isn't really okay for non-trans people to say, but if it, just kind of reclaiming like it as a gender neutral pronoun. I mean, it really depends on the person. I use they, I prefer they. He doesn't feel right yet, and she, I mean, doesn't necessarily bother me, but I think in the future it's going to be weird if you call me she. I think you'll look kind of weird. I'm not going to be the weird one in that situation, so that's going to be kind of funny. But, yeah, and your follow-up in this question, Jeannie, was that they is kind of a challenge grammatically, and yeah, that's something I do hear a lot from people who, which I think is strange because people do unconsciously use they as a gender-neutral pronoun very often, or they unconsciously use it as a third-person singular pronoun really often. Like I remember there was a post on Tumblr that went around of someone who was kind of taking the grammatical criticism of they and saying, if I don't know. If I'm talking about somebody and I don't know their gender, I'm going to use he/she to describe them. It's like you just said, like, if you don't know their gender, like, clearly you do it unconsciously. Historically, like, linguistically, they has been used as a third-person singular pronoun for most of modern English, like, since Shakespeare. So, it's definitely, as far as more informal English goes, it is grammatically correct. So there goes that argument. Yeah. As far as like it being uncomfortable, I mean, someone hearing the wrong pronouns is way more awkward than you having any discomfort around using a word that might seem grammatically awkward for you. So that's kind of my opinion on that. And just the general rule of pronouns is just ask. People have very different answers to that, like all across the board. So this last question, which I saved for last because it's definitely, I'm going to talk the most about it, because it's, right up my alley. I'm very interested in, like, metaphysical transgenderism. So this question is, after gender reassignment surgery, have you heard of individuals losing sensation or experiencing any negative sexual side effects, pain or anything else? This would be good to know if Jeannie ends up counseling patients about it in the future. She says she's been trying to contact surgeons, but to no avail, and has asked a vulvovaginal specialist about it, but she says that with all her time in the profession, like over 20 years, she's never been asked that question. So yeah, I mean, that's definitely interesting, and as you do have greater visibility for trans people, it does become a challenge to then make them feel comfortable in healthcare, which is obviously extremely important. You need, in order to feel comfortable accessing and prioritizing your physical health or mental health, you need to feel like where you're going is going to make you feel humanized, and support who you are. So that being said, I think it's really funny when people who aren't trans, whenever they talk about the physical side of transition, it's always like a gender reassignment surgery. Like it's like one thing, like one surgery, and then boom, you're like the other gender. Like that's not how it works. Be cool if that was how it works, but it's not. There's a lot of different options and things that transgender people have and do as far as the physical side of transition goes. There's hormone replacement therapy, which is generally the primary method that most transsexuals, as opposed to transgender, transsexual means specifically people who choose to change their physical bodies, their physical selves, in order to align with their gender identity. So some of those, like the first or like the primary method that most transsexuals use is hormone replacement therapy, which is basically introducing hormones into your body that would make you go through the puberty that matches your independently determined gender. So, you know, like going on testosterone or going on estrogen. And, you know, the body's really amazing. You put yourself through a puberty, like, it's the exact same as the puberty you would have gone through naturally. It's, human bodies are very adaptable. It's really very fascinating. And I think, you know, I feel like a lot of trans people are kind of, apprehensive about expressing this kind of stuff, but for me, the versatility of the human body and just exploring my physical limits is a big part of my identity as a trans person. I do have a lot of feelings about the like tangible value of the body, and I don't know, like cyborgism and like what the body is naturally versus like what we can do with it with technology. And since technology is humanly made, we're modifying it with our own things we've created to modify. I don't know, it's just like, it's very interesting. Like the human body is fascinating. I love it. Anyway, so yeah, and then, you know, there's other kinds of surgery, like there's top surgeries and bottom surgeries. Like top surgeries, you have like breast augmentation, breast enhancements. There's like, you know, actually male top surgery is not a mastectomy. There is still breast tissue. Breast cancer is still a risk for female to male transsexuals. So that's, you know, something that is not really understood in the medical community, where you might have someone come in who looks male, who is, you know, legally male, but still has breast tissue. And I mean, but also breast cancer is, you know, men are at risk for it too. But, you know, female to male transsexuals still should have yearly breast exams, things like that. So yeah, it's called male reconstructive chest surgery. It's more of a breast augmentation or reduction rather than a removal of all mammary tissue. Yeah, and then there's bottom surgery. There's lots of different options. You know, that I don't really feel super comfortable talking about, mainly because I'm not fully informed enough about bottom surgery to really talk about it as any sort of authority, but those you can definitely go and research. But yeah, I mean, as a trans person who's not personally pursuing surgery, I definitely, you know, one of the big reasons I'm not is fear of discomfort and you know, losing sensation and stuff like that. And just, you know, I don't think it's fair that you know, transgender people are kind of expected to undergo painful and life-threatening procedures to conform to something that is decided by people who aren't us. Like, I mean, that gets me into like the most interesting part about these sort of questions about physical transition is the kind of the crux of the contemporary transsexual argument, which is has to deal with the sexed body and like the physical binary that is upheld by medical professionals. Because, you know, this is going to seem really out there, but you can totally research everything I'm about to say. I read a lot about this sort of thing. But you know, naturally in nature, there is no physical binary 100% of the time that manifests as male and female, as like clear-cut physical binary. That does not exist in nature. You know, there's many plants, animals that have, you know, hermaphrodism. There's also intersex in humans. Like, that's not a biological given. And, you know, instead of accepting that there are anomalies and that things don't fit exactly 100% typical biotype, whether you're measuring by hormones or you're measuring by, you know, physical genital structures, what's 100% male, 100% female, instead of accepting that, you know, there is biological wiggle room and that is natural gender or natural sex is like all across the board. Like, we've instead tried to police, as like a medical community and medical society, and people have tried to police that that physical binary through, you know, you can read all about intersex studies and the historical treatment and you know, mass medical mismanagement of intersexual and intersex patients during the 1950s and the, you know, earlier half of the 20th century. It's really sad, like, you know, kind of intersex patients, and this still happens today, intersex people not really having a say in what gender they're raised as, and then, they might experience a different puberty. And a lot of that, intersex research is what paved the way, and like, for endocrinological research, which then, like, paved the way for hormone replacement therapy, which then became a way for people who identified as, gender deviant and sort of in this gender nonconforming, what we now call transgender umbrella, to be like, have access to actual medical technology, transsexualism as an identity and as a reality, like an actual medical reality, is only come after the availability of techniques to actually make that happen. There's, like I've discussed before in blog posts, there's a lot of like historical groundwork for people who definitely may have, based on their writings during their life, and other people's accounts would definitely have identified as transgender, and may have, if transsexuality was something that was, actually a reality for them, like, they might have pursued that. But yeah, there's no way of knowing. Transsexuality is definitely a modern phenomenon, and that's something I think a lot of transsexuals are kind of afraid to talk about. But like, the only reason that, trans people are able to make these amazing physical changes is because the technology exists. Like, I don't know if that really answered anything, but yeah, it's just like right now, the transgender community is trying to sort of uproot that, like, idea that's been upheld by embryology and endocrinology and like plastic surgery and all these like medical fields, that there are these like biological, like, male, female, that then became misconstrued into man and woman, and it's kind of so hard to explain this without getting like too unlayperson's terms, or like too like theory words. Basically, right now, there's like a controlled path for people who are transgender. It has to be like a disorder, like a gender identity disorder. It's like transsexualism is like a disease. Like, it's just this whole, and then like, the cure for the disease, instead of before, it was they would try and go through like all this psychotherapy to try and make you more feminine or more masculine. Now it's like, well, changing the body would be easier. Why would you shame the human being? Like, if there's the availability to change the body. So that's kind of where that came from. But now it's a lot of, what I hear more of is a lot of rebellion against even the idea that we should be having surgery and that we should conform to a physical binary that doesn't exist in nature. Like, it's just so many people who come out as trans and then, access care, get told that they have to follow this like prescribed path of like, you get the gender identity disorder diagnosis, and then you go on hormones, and then you get top surgery, and then you get bottom surgery. And it's like, I'm afraid that with transsexuality being so pathologized, and then all these like prescribed treatments of hormone therapies and surgery is just kind of being pushed, I'm afraid that some trans people don't even really stop and think about, like, is this something I want, or am I doing this because this is what society and like medicine, like, science, which like is biased, like there is a lot of bias in science, have decided this is what a man looks like, this is what a woman looks like. Not all men in nature look the same. Not all women in nature look the same. If you were to take a bunch of like transgender people and like who have never had surgery or have just done hormone therapy and put them in a room with a bunch of cisgender people, you might, like, in clothing, like, you might not be able to tell the difference. Like, even like it's not, I don't know. I probably didn't answer that question well at all. Let me go back and see if there's any way I can kind of, I don't know, shorten what the hell I just said. But yeah, there are, surgery is something that not a lot of people pursue for a lot of reasons, and there's definitely a lot of risks of sexual side effects, which is a reason that a lot of people don't pursue it. But the focus, I think, for people who are caring for transgender people and, you know, as health professionals, is to let the transgender person have agency over their own body and be able to own their own body and decide what they want to do with their body. It's theirs. Like, if you know, you have a trans woman who doesn't want to get, you know, breast implants, that's fine. Like, if you have a trans man who wants to keep his breasts, like, that's fine. Like, you know, there's plenty of guys who walk around this planet with bigger breasts naturally than I ever will have. Like, and, you know, they're still, like, widely accepted as men. I don't know. It's just, bodies are mystifying. But I think, you know, I think medical professionals should just, you know, let transgender people dictate what we do with our bodies. Everybody else, you know, there's so much push for, like, you know, women have, you know, agency over their own wombs, their own reproductive system. You know, people are, you know, having agency over your own body and not having your body legislated is a really hot topic right now, and that should absolutely extend to transgender people. Yeah, and that's pretty much all I have to say about that. Oh my god. So much shocking. Let me just double check that no more questions came at me. Okay, yeah, that's it. So, have a great night, everybody. I hope I was helpful again. Love you all, and stay posy. Good night.